second part. An inflammatory disorder of the joint. Rheumatoid arthritis is an inflammatory disease primarily affecting the periarticular tissue and secondarily affecting the bone. Clinical finding: in acute cases, there is a bilateral stiffness, deep-seated pain, tenderness on the palpation, and swelling over the joint. There is limitation on the mouth opening. In chronic cases, crepitus is the most frequent finding. Functional disturbances like deviation of the opening and inability to perform lateral excursion are common. Radiographic finding: the joint space may be reduced. There is a flattening of the head of the condyle, erosion يعني يصير erosion بالcondyle, bone destruction which occur in the articular eminence. This panoramic view shows irregular erosion on the right and the left side of the condyle with the flattening of the articular eminence. In advanced stage, erosion of the anterior and posterior condylar surface at the attachment of the synovial lining occurs, which may resemble to sharpened pencil or mouthpiece of flute, as shown in this picture. Clinical diagnosis: subcutaneous nodule, bilateral involvement and pain on the biting. Many joints are involved at the same time. Radiological diagnosis: sharpened pencil appearance and flattening of the articular eminence. Management: supportive treatment اللي هو يكون إنه rest للjoint and sovdite is advocated. Non-steroidal anti-inflammatory drug نصرفها للمريض and surgical synovectomy إنه it is removal of the synovial membrane which is responsible for enzymatic destruction of the cartilage. Local treatment: it is done with head and jaw exercise or mouth stretcher, muscle strengthening exercise and hydrotherapy. Infection: arthritis, it is also called septic arthritis. It causes may be acute or chronic. سببها إنه spread مال organism من مكان صاير بإنفكشن مثل الماستويد بروسيس أو tympanic cavity أو عن طريق البلود. It is managed by هم نفس الشيء limitation للmovement, liquid diet and appropriate antibiotic and analgesic should be given. This CT revealed the intracapsular abscess formation in the left TMJ with widening in the joint cavity. Traumatic disorder of the TMJ: أول شيء dislocation. Dislocation is a result when the condyle is forcibly displaced anteriorly by failure of the muscular coordination out of the articular fossa but remain within the capsule of the joint. Clinical feature: anterior dislocation may be unilateral or bilateral. In acute dislocation, there is history of injury, gauging of the molar teeth and anterior open bite. Superior dislocation occur after being punched as the mouth remains open. Since great force occurs in punch, the angle of the jaw will be forced upward, moving toward the condylar head. Posterior dislocation: it is a result from severe injury, which force the mandible backward, so will push the jaw back, affecting the alignment of the mandibular, condylar, and mastoid process. There may be tendernesses over the affected TMJ, limited mouth opening, and posterior open bite. Diagnosis: بالclinical diagnosis الانterior open bite ممكن تكون موجودة with gauging of the molar teeth. This يعني aid in the diagnosis of the dislocation. براديوغرافيك راح نشوف إنه empty articular fossa as shown this radiograph. Management: reduction of the dislocation أما يعني so manual reduction as shown this picture. This is manual reduction of TMJ dislocation أو عن طريق injection of the local anesthesia within the joint. بعد يعني دقائق راح spontaneous reduction للjoint without بدون ما نحتاج يعني إنه هو manual reduction. Under general anesthesia with the aid of the muscle relaxant نستخدمها لما يعني الطريقتين اللي ذكرناهم ما نقدر نستخدمهم بسبب إن البيشنت unduly apprehensive فنستخدم هاي الطريقة. Disc displacement. Disc displacement, the most common TMJ disorder in which the disc is displaced anteriorly. It may be with or without reduction. type anterior disc displacement with reduction, anterior disc displacement without reduction, والposterior disc displacement. Anterior disc displacement with reduction, this condition is caused by articular discs that have been displaced from its position on the top of the condyle due to elongation or tearing of the restraining ligament. The displaced disc return to its normal position when the mouth is opened. يعني لما الواحد يعني patient يفتح حقه فراح يصير يرجع الديسك إلى مكانه بس accompanied by popping sound. Diagnostic criteria: if the pain exists, it becomes severe upon the joint movement, repeatable noise, usually upon opening and closing. MRI demonstrate disc dislocation, which is greater upon opening. Anterior disc displacement without reduction, there is alteration in the translating movement and abnormal relation remain in the opening and the closing. Thus, the disc doesn't return to its correct position and remain dislocated anteriorly without any correction during translating movement. Posterior disc displacement, the condyle slipping over the anterior rim of the disc during opening, with a disc being caught and brought backward in the abnormal relation to the condyle when the mouth is closed. Management: biplane appliance. It is involved one يعني نستخدم البايتبلين appliance حتى الماندبل أو الماوث يبقى slightly open vertically. Next phase is occlusal adjustment and restorative and orthodontic treatment. Post operative physiotherapy همينا نستخدمها. Ankylosis هي a Greek word معناها إنه stiff joint. It is abnormal immobility and consolidation of the joint. Ankylosis of the TMJ ممكن سبب trauma أو سبب infection أو ممكن congenital أو سبب rheumatoid arthritis. It can be true اللي هو intracapsular أو false اللي extracapsular والبوني and الfibrous أو partial or complete. Unilateral mouth opening is impossible, but the patient may able to produce several millimeters of interincisal opening. Asymmetry راح أشوفها بالface with fullnesses on the affected side and relative flattening on the unaffected side. In unilateral ankylosis, the patient face is deviated toward the affected side. The chin is retracted on the affected side and slightly bypass the midline. Radiograph feature: the ramus is vertical and the angle is reduced in size. The bone is of the jaw is short. The joint space is completely or partially obliterated with the dense sclerotic bone, as shown in this OPG. Show loss of the joint space in the bilateral TMJ joint. Management: أما نستخدم condylectomy if the ankylosis in the intra-articular, or osteoectomy of the part of the ramus if the coronoid process and the zygomatic arch are also affected. TMJ imaging مثلا ال MRI, ال CT, الالتراسونوغرافي conventional radiography. Panoramic radiography can help evaluate the following: degenerative bone change, asymmetries in the condyle, hyperplasia, hypoplasia, trauma, and tumors. This panoramic radiography important asymmetry نشوفها مثلا يعني إذا asymmetry بالتي ام جي كنا أو tumor or hyperplasia, hypoplasia. Plain radiography consists of transcranial projection of the TMJ. Different angulations are used to avoid superposition of the temporal bone and the opposite TMJ. Lateral oblique transcranial projection, anterior posterior projection, submental projection, and transpharyngeal view. CT يعني يكون superior للconventional radiograph because there is ability to depict the greater portion of the joint. By providing the series of radiograph, tomography can produce a small change in the central portion of the TMJ and therefore decrease the false negative interpretation. This is the CT scan. An MRI is currently considered the reference method for imaging soft tissue The structure of the TMJ اللي هي articular disc, synovial membrane, lateral pterygoid muscle, and has been pointed out as the best imaging modality in the diagnosis of the disc displacement. This is an MRI radiograph. Ultrasonography, it is non-invasive and dynamic, inexpensive procedure. It is not commonly used in TMJ exploration, being a real-time investigation to provide information about the disc position during the mouth opening. This is ultrasonography. Treatment of the TMJ can be divided into two categories. أما conservative اللي يشمل لي pharmacological, physical, behavioral. ممكن نستخدمها واحد من عندهم أو نستخدمها in combination. السيرجري نستخدمها بنسبة كلش قليلة، تقريبا 5% من المرضى يحتاجون السيرجري. مثال عندنا open joint procedure والarthroscopic surgery and arthrocentesis. conservative treatment من الميديكيشن، الفارماكولوجيكال مانجمنت. الميديكيشن تشمل الاستامينوفين is one of the oldest and the most widely used pharmacological agent for treatment of osteoarthritis. Also use non-steroidal anti-inflammatory drug على نعالج الاوستيوارثرايتس، منها تقلل البين ومنها تقلل الانفلاميشن. Physical treatment. A common form of physical treatment involves fabrication of occlusal appliance or bite splint designed to limit the movement of the mandible. In behavioral treatment, we focus on biofeedback, relaxation, and cognitive behavioral treatment because these are most widely used for treatment of TMJ disorder. Surgical treatment is appropriate only when there is unidentifiable pathology amenable to surgical intervention, there is a resultant loss of mechanical function, or there is pain related to joint pathology. The following TMJ articular disorder are manageable with surgical intervention. مثلا internal derangement اللي هي disc displacement disorder, non-inflammatory disorder والinflammatory disease والneoplasia والankylosis. The type arthroscopy, this is one of the most common surgery which require less invasive. In this there will be a small incision near the ear from where the surgeon can insert a small instrument on which the scope is fixed at the end of it. Arthroplasty, as shown in this picture, it is called open joint surgery. It has a larger incision near the ear which help to expose the joint of the jaw. The patient who have arthroplasty have more pain and longer recovery as compared to arthroscopy. Arthrocentesis is done by injecting fluid into the joint. The fluid washes out any chemical byproduct of the inflammation and can help to reduce the pressure that cause the joint to be stiff or painful. Thank you.